Please pay particular attention to the safety components of this skill, including your body mechanics, the patient's foot placement, and when to lock the wheelchair. This skill will start with the opening. Knock and identify your patient, introduce yourself by name and title, describe what you will be doing, obtain permission, close the curtain, and wash your hands. Obtain a gait belt from its storage location. The evaluator will introduce you to the room before you begin your skills and show you where all the supplies are kept at the testing facility. If you do not remember where the gait belt is located during the test, you can ask the evaluator. Open the wheelchair, positioning it at the end of the bed. You can place the gait belt in the wheelchair until you are ready for it. Do not pull the wheelchair close to the bed at this time. Pull the patient's sheet down toward the foot of the bed and explain what you will be doing to prepare the patient for this skill. If the patient does not understand why you are uncovering him, he may become fearful. Ask the patient to scoot his body toward the edge of the bed closest to you and cross his arms over his chest. Put one arm under his shoulders and one hand over his farthest knee. Brace your knees against the bed and bend your knees. Pull his knees towards you as you swing his shoulders up and around until the patient is sitting on the side of the bed. Keep your hand on his back and ask about dizziness or weakness. Ensure his feet are flat on the floor for safety. Have the patient scoot forward if necessary to ensure the feet are flat on the floor. Locate the patient's shoes, put them on, and fasten them securely. The patient must be wearing non-skid, hard-soled shoes when getting out of bed. Pull the wheelchair closer to the patient and position it at the side of the bed at a slight angle toward the patient. Place the gait belt around the patient's waist, tag side in, and fasten it appropriately, making sure it fits snugly around the waist, but ensuring that you can fit 4 fingers between the gait belt and the patient's abdomen. Bring the wheelchair as close to the patient as possible without touching the patient, and lock the wheels. Place one foot in front of the patient's feet and stand at an angle with your feet shoulder width apart. Explain the procedure to the patient and ask them to put their hands on your shoulders while you grasp the gait belt around the patient's back. Bend your knees and lift with your legs, lifting the patient up and over to the wheelchair, seating them into the wheelchair in one motion. Keep your back straight and your knees bent as you lift. Remove the gait belt from the patient and have the patient shift his hips back toward the rear of the seat. Unlock the wheelchair and turn it to the side so you can swing the leg rests in. Gently lift the patient's legs and place them on the foot pedals as you fold the foot pedals down. Lock the wheelchair. Make sure the patient is comfortable and ask if he needs anything else. Give the patient the call light, open the privacy curtain, and wash your hands. Review the steps of the skill and make any corrections. Tell the evaluator your skill is done.